authorized Yeti dealer and have a full line, so you'll find the perfect gift. Central Tine Lumber on the Hill in Petersburg and Hyde Street, Moorfield.
Glad you could join us for the ride this morning here on WELD. We're back with Masih, Wade Rohrbaugh. How y'all doing today?
Fine, thank you. How you doing, Steve?
Wade is reluctant. He's still trying to stay off camera. He's a handsome devil. So, we had sent out search parties and hunting dogs and everything else for Raj. Had no idea where he disappeared to, and then we were told he was kind of busy. So that's good, because we're trying to make a dent in this drug problem, this plague that we have. So what do y'all brought me a couple of brochures. What do you want to talk about?
Well, what I want to talk about, Steve, this morning is an emerging public health crisis called Neonatal Abstinence Syndrome, NAS.
Okay.
And this basically is the syndrome of babies who are born to mothers who are addicted to opioids. And this is becoming a massive, massive crisis. And, West Virginia leads the nation in a lot of bad statistics, and unfortunately, the neonatal abstinence syndrome is also one of the areas in which per capita West Virginia leads the nation in number of babies born to mothers who are addicted. Neonatal abstinence syndrome is we talk about addicted babies, drug babies. That's really a misnomer and not the correct word to use, because these babies are not born addicted. They're born withdrawing from opioids that the mother's bloodstream has been bathing them with for months and months throughout the entire gestational period. So neonatal abstinence syndrome is, nationwide. Statistics from the CDC from 2014 show that there was anywhere between 29.7 to 31.1% of pregnancies have been affected in some way by either drugs or alcohol. So this is a massive number. In our state, in West Virginia, the most recent data we have is collected from 2009 to 2013. And this data is collected by the West Virginia Healthcare Authority. And it looked at, in that time period, from 2009 to 2013, there were 119,000 live births. And of that, there were documented 1,974 babies born with NAS. And looking per capita, in 2007, we only had 7.9 babies with NAS per 1,000 live births. And by 2013, this number had jumped up to 31.8 per 1,000 live births. And Southern West Virginia leads the nation in 48.7 cases of NAS per 1,000 live births. So this is a massive problem in our state. So kind of what is NAS? This is a syndrome characterized by withdrawal. Mothers who throughout their pregnancy have used opioids, heroin, OxyContin, oxycodone, injected, snorted, taken it orally, or who have been, a lot of times physicians, when they recognize that a mother is addicted to opioids and now she's in early pregnancy, many times they'll initiate medication-assisted treatment with Subutex, which is buprenorphine. It's similar to Suboxone, but it doesn't have the naloxone component. And so this is felt to be safer for the pregnant mom. It's prescribed by a physician. It can be monitored closely. They're not using dirty needles, exposing themselves to hepatitis C, hepatitis B, HIV, other sexually transmitted diseases that go hand in hand with procuring drugs for one's addiction. And so this has been felt to be a safer method. You bite the bullet right up front that we're going to go ahead and use Subutex in these pregnant women and medically manage the withdrawal in the neonate after birth. So neonate is defined as 0 to 4 weeks, an infant 0 to 4 weeks. And typically how this is diagnosed, studies by the CDC have shown that 27.9 mothers do not report. 27.9% of mothers do not report all the substances that they have taken. Part of the prenatal screening process involves, are you on drugs? Are you smoke? Do you smoke? Do you take alcohol? So these kind of questions are routinely put to moms, and 27.9% of them lie about this right up the front. Oftentimes the reason for not wanting to disclose this is fear. Are they going to take my baby away? Fear, am I going to be prosecuted for this? So a lot of fear abounds, and this results in many, many moms who are using opioids not receiving the prenatal care that they should, that they must, in order to have a healthy infant. And I would just encourage you to look at this through the lens of addiction as a brain disease. You can imagine a mother who was found out she's pregnant, who was a heavy, heavy heroin user, who is now, grief-stricken, angst-stricken, like I'm struggling with my own addiction, and now I have another life inside me. So, and this is the insanity of the disease of addiction, that to use drugs, the compulsion, the craving to use drugs in spite of adverse consequences, not only to themselves, but to their unborn child. So if we look at it through the lens of addiction as a brain disease, it may be possible to assess this. This is a very controversial topic. Yeah. And many people think right up front, lock them up and throw the key away. This is horrible. This is, there's a public outcry against this. And there is a lot of stigma associated with treating NAS. And these women are stigmatized in hospitals, by healthcare providers. So what happens in NAS, if you can imagine a infant who weighs 7 pounds being exposed to doses of opioids 20 to 30 times higher than what you would ever prescribe for an infant that size. A mom who's using something, that's literally the correlation, is 20 to 30 times the dose. And abruptly, at the time of delivery, the brain, the infant brain being used to, the central nervous system being used to being bathed in this drug for so many months, is abruptly cut off. And now that infant is in acute withdrawal. And this withdrawal is horrible. And these infants who are born with NAS, you at once, a clinician will recognize that something is terribly wrong with this infant. Just unconsolable crying, shaking, tremors. They have any withdrawal sign or symptom that you'll see in an adult magnified 100 times in this infant. They can have seizures, that not just a one-time seizure, but something called status epilepticus, a seizure which will not stop. There have been case reports of infants who are born with a stroke, paralyzed in half of their body, half their brain destroyed or damaged as a result of this. So the consequences of this can be devastating. And so they're shaking, they're trembling, they have diarrhea, just non-stop diarrhea. They are hungry. They can't feed. They're fussy. They literally, their nose is running, their little hands are rubbing. They take the skin off their nose and their hands from rubbing their nose. They're not getting enough nutrition. Their skin, they have massive diaper rash. They rub their legs together. They're just, as part of the withdrawal symptom, they're rubbing. They rub their legs so much that the skin actually chafes off. They excoriate their own skin. And it is, and this can last anywhere from, a week to up to 79 days, depending upon what the substance is. And healthcare facilities have set up special neonatal intensive care units dedicated to dealing with NAS, with very specially trained staff. These places are very low stimuli, because any kind of stimuli, light, sound, movement, intensely bothers these infants. And so they're all low light, all monitors are turned off, unlike a modern intensive care unit, which is full of beeping monitors and sounds and flashing lights. So it's very dark, very controlled access. They have to be swaddled, they have to be held in a certain position. So a lot of non-medication type supportive measures have to be used to console and comfort these infants. And then, of course, they're medically treated. They are treated with medications such as morphine. They're treated with medications such as Valium to control seizures. Their blood pressure goes very, very high. Their heart rates go high. Their temperature goes sky high. Infants don't normally sweat, and these infants are just bathed in sweat. Their autonomic nervous system is firing so rapidly. And so it takes a lot of things to control these measures. So the goal of treatment is really to reduce the symptoms, keep them comfortable, allow them to feed, to gain weight. Because their activity level is so high, they're burning up, their metabolic rates are sky high, so they need frequent high-calorie feeding. They need special care so that they don't become dehydrated, so they need IVs, they need IV fluids. And it's a very rocky, very tenuous course for the first week to 2 weeks for most infants with NAS, and requires a very specialized skill set to care for them. It is associated with a high mortality rate. So this has become a growing problem. And how this is diagnosed, usually you have to have a high index of suspicion. So statistically, they've looked at, who is at risk for developing NAS. Well, they look at either self-report. The mom comes out and straight up says, I'm on heroin, I'm on oxycodone, I'm taking Xanax, or things of that nature. If they don't self-report, then they're, drug testing. It can be hair test, can be a blood test, can be a urine test. They test the cord blood when the baby is born, and the cord blood gives you a very accurate measurement of what is inside the baby's bloodstream right now. So that is the 100% gold standard for diagnosing NAS. And then, of course, there's so many different ways, the way they present. There's a scoring system devised by Dr. Finnegan way back in 1975, and they use this scoring system, which takes serial measurements of 20 different parameters to determine how is this infant doing, getting better, worse, getting better, worse. And the gold standard is this number 8. And when it's 8, or that's when they start titrating and weaning off the medicines they're using, be it morphine. Be it some places use even Suboxone, some places use methadone, some places use Valium, clonidine, and then they slowly start titrating those things, weaning them off those medicines. And as they start to gain weight and become more calm, they can gradually be discharged from the hospital. Okay. But this is a huge problem.
We're running out of time.
Sorry.
I some questions I think might be. So we have an overview of this horrible problem. You're king for a day. You can set up how to solve this problem. Of course, we after the baby has been in the womb and experiencing these drugs, that's too late. What do we do? What do we do to prevent it? Or what are the legal ramifications? What are the moral, ethical parameters that physicians operate under? What can we do to help the situation?
I think if you look at it from the standpoint of reverse engineering, how did we get there? And that's where this must start. So prevention works, and the basis of prevention, I believe, in this instance, is education. And, as we've discussed before, you and I, that, addiction being a well-recognized chronic medical disease, and a component of that disease is exposure to the drug. If you're not exposed to it, your chances of becoming addicted to that drug, to any drug, are very low. So if we can, initiate this conversation at a very, very early stage in, elementary school, middle school, high school, college, that's an important thing. Obviously, you and I have also talked about regulating the pharmaceutical corporations who manufacture these drugs and, encourage physicians to prescribe them. That has to change, a radical new way of how we are treating pain, who should be treated with a narcotic prescription. This is something which, massive change in how we educate physicians has to take place. And then again, I think that a dedicated treatment component of this must start before pregnancy, during pregnancy, and after pregnancy. Because, now you have a mom who's delivered this baby. There has to be a component of treatment for that mother. So I think collectively these things, coupled with good law enforcement, can reduce the burden of this disease on society.
You mentioned 27% of the mothers won't
not
self-report
it. Yep.
So, what do you do then? What does a physician do?
So a physician must have a very high index of suspicion. So they've looked at things like, well, what are the risk factors? Some of them are more than 4 babies. Number 2, if you're on Medicaid. Number 3, has CPS ever been involved in this family? That's a red flag that you must look for. Is there a history of injuries? Is there a history of domestic violence? These are the kind of things that you should raise a red flag, that should, encourage you to do a drug test at every visit.
Okay. I'm wanting you to educate me. So the doctor has suspicion. Now, is there a mandatory? Because you said one of the fears that the mother has is they don't report because they fear they're going to get in trouble. So, what are the mandates on the physician in situations?
So there is in our state mandatory reporting to CPS if a documented case of neonatal abstinence syndrome is uncovered. So that component is there, and CPS.
And then what happens?
CPS has under their jurisdiction many things that they can do, depending upon, is the mother, committed to her own recovery and committed to be a good mom? Does the mom have no interest in recovery and no interest in being a mom to this baby?
Okay,
so
let me stop you there. So CPS gets involved,
right?
Because the doctor, mandatory reporting, he had to,
right.
I think we have a drug problem here. CPS comes in, and the first thing they're going to try to get the mother to do is commit to treatment.
Correct.
So it's not like the mother who's in this situation. If she cares for this child, she has help.
Yes.
They're going to insist that she get the help.
Absolutely.
But they're not going to say, you're a drug addict, we're going to take all your kids away from you. Sorry, game over. That's not what happens.
Not in that instance. No, it will not.
Okay. So the mother doesn't show any indication that she's interested in herself or her baby. She's going to keep. She likes what she's doing. She likes the addiction. She's not interested in recovery. Then what happens?
Then in that instance, CPS will step in, and this child will become a ward of the state, and will more than likely be placed in an appropriate foster care family. And at some point down the road, if this mother, does enter recovery, does go through treatment, and has satisfied court requirements, there's a possibility that she could gain custody and have a relationship with her child again.
Suppose, I'm forgetting about Metro. We're not going to do that today. A mother comes in. She tested positive at the earliest stage she could find out that she was pregnant. She knows she has a problem. She comes to the doctor. So she's been taking drugs, and so that fetus has been exposed. Is there a stage at which, if we catch this now, little or no harm is done to the baby, or is what's
Excellent.
What are the numbers on that?
Excellent question. So during the first trimester, early first trimester, if there is a mom who has been using, let's say, heroin, and now in the first trimester makes a decision, I'm gonna quit this, and she makes that determination and stops using. So at that point, she probably would be okay. The baby would probably be okay. However, as the pregnancy progresses, there's a true danger of the mom abruptly stopping opioids. There's a danger to the baby. So at that point, the prudent thing to do is to initiate medication-assisted treatment with something like Subutex.
Okay.
So.
Okay. You talked about the physical symptoms of a baby. Do we even know at this point all the mental emotional, nervous system effects that this has on a child long term?
This is the biggest piece of the puzzle that's missing in this entire emerging public health epidemic. Is we don't know. Long term, there are no studies of this. There are no studies on outcomes of these babies. Now, fetal alcohol syndrome has very well established 50, 60 years of studies on how these kids do. And most of them have cognitive impairment, have impairment in how they interact with peers, and require some type of supportive environment for the rest of their life. We don't know those things about neonatal abstinence syndrome related to opioids. So at this stage of the game, those studies are being developed.
So I'm a father. I'm a father. The mother of my child is using drugs. What can I do?
Again, as a father and your daughter's using drugs, and is your daughter pregnant or not?
No, I'm the father, and the mother of my child is using drugs, or
right.
Whatever
So
scenario.
100%.
What can I do? What can I do? I know this is bad for my baby or my grandbaby.
So you must encourage your significant other to seek help. You must encourage. That conversation must take place with the obstetrician. A conversation must take place. She needs to get plugged into treatment right now. Treatment can start at any time. It's not the air of a building. It's not the room. It's a mindset. It's a change of mindset, and it's a supportive environment that helps someone get through this and walk that road into recovery. So the sooner that starts, the better this is going to be for all parties involved. So that conversation must take place. You must encourage the mother of your child to have this conversation with the obstetrician, seek help through treatment, like in our area, through the Potomac Highlands Guild. So there are numerous outlets for this, but that has to take place.
Yeah. I haven't even gotten to Mr. Rohrbaugh. Like your glasses.
I knew I wouldn't have to talk today. I'd just come in.
You know what? I usually have ABC News. I got about. I'm going to stretch it through ABC News. I got 6 minutes left because you haven't been here for a while, and I've missed these Thursdays, and this is just a fascinating conversation, and so I'm going to forego our ABC. What's the worst that could happen? They'll yell at me somehow, but. So you brought a couple of brochures. I want to make sure we talk about the Grand Hearted Recovery Network and all that you all are doing. I'm so excited that finally, maybe it's been taken seriously before, but for the first time, I'm seeing that it seems like we're actually getting something done. You want to talk?
Yeah, I believe I do.
Okay.
As well as you know, we started out back in July, and we had one meeting a night for 8 weeks. It was a Tuesday night meeting, and we moved up to now, 5 months later, we have a total of 28 a month.
Wow.
That we're doing, that we are putting on as Grand Hearted Recovery Group. That's counting our meetings. We have a drop-in center that people can come in and needs help Monday, Wednesday, and Friday from 9 to 12. We also have an NA meeting Monday, Wednesday, and Friday at 10 a.m. We have a NA meeting Tuesday night let me go back. This is at the First Baptist Church in Petersburg on Virginia Avenue. Then Tuesday night at 7:30, we have a meeting, an NA meeting, and a Neonatal meeting at the training center on the
Potomac Highlands Guild Training Center on Fisher Street.
Thank you, Roger.
Okay.
And then Friday afternoon at 1 o'clock up at Van Devener Drive, the Guild building there, we have a meeting at 1 o'clock. And then Saturday evening at 6:30, Van Dievener Building, we have another NA meeting. So it sort of keeps you pretty busy with all these meetings and everything. And this week, since Christmas is on Sunday and it's a bad time for everybody, we're going to have a special meeting. Sunday night, 6:30, Van Dievener House, the Tommy Callan Guild Building. We're having a meeting for anybody that needs it. We are an open group. Anybody's welcome. We just put on a dedication for Russ Hedrick. He has 30 years in this community and the surrounding communities, helping with AA and different things that he has helped with. We actually done a big Christmas dinner this past Saturday night, and we was hoping, he was sick, he didn't make it, but we wanted to present him an award. We got to present it to him Tuesday night. He come to our meeting, and that was from the Grant Hardy Recovery Group and Potomac Highlands Guild. We presented him a plaque with 30 years of being in this, and we was very, very happy. I think he was very touched. We had a great time. We let him speak the entire meeting to let everybody know what he went through in the past 30 years, and I think a lot of people got a lot out of it. I think it was very important that he was there.
Yeah.
Now this Saturday night, I took it, well, I talked out through the group, and I went up to the nursing home this past week. We're going to have a meeting this Saturday night at the nursing home for Russ Hedrick.
Is that right?
So anybody's invited. Come around to the back and come in back there where they play bingo, and there's going to be our meeting. So we'll have coffee and cookies, and we'll sit around and do a lot of talking. So,
well, that's great.
And with that, I know you're running out of time, so I better stop.
Well, I'm glad. I'm glad you both came. We have like a minute and a half left. What do you want to say?
One more thing.
Okay.
We're having a sober New Year's dance at the Potomac Highland Guild Training Center Saturday evening, New Year's Eve. And it's going to start at 6:30. That's our meeting time. And then we're going to have a dance after that. We're going to have a TV in there and everything. They're going to be able to watch the ball drop. So I think it's going to be great.
Would it be accurate to call that a safe place to celebrate the New Year? Would that be a good term? Okay, yeah. That's great. Yeah. That's great. Are the holidays, I don't know if this is the right term, a trigger for abusing?
It's a hard time.
Yes, it is. I mean, this, statistically, this is the greatest time for relapse for people for various reasons. The holidays have been associated with a lot of drinking and drug use historically, and for someone who's in recovery, this is a major trigger. So by creating all these special meetings at these peak times, we hope to be able to, create a safe environment for people to still celebrate and yet be surrounded by people in recovery and not be tempted to go down the wrong path. So.
Right. Great idea. We're out of time. Glad you all came in.
Well, thank you, Steve, very much.
Phone number? Give out a phone number.
Again, so phone number if anyone needs help. If you're a parent of someone who needs help, we've got a couple numbers. If you have a pen, write these down. 304-257-1583, 304-668-8060, 304-668-6329. I'm going to say them again, one more time. 304-257-1583, 304-668-8060, and 304-668-6329. So these are the numbers that you can reach 24/7, 365 days a year. If you're looking for help, looking for answers, please do not hesitate to call.
Okay.
And we want to be there.
Good having you. It's time for Talk Line with Hoppy Kirchfield. You all have a great day. God bless. You're listening to 690 AM WELD, Fisher, West Virginia.
Activated telephone. Switch network control from Charleston to Morgantown.
Stand by. Q Hoppy. You're on.
Good morning. Welcome to Talkline on Metro News all across the great state of West Virginia. Happy Kercheval with you. J.R. Falls. Our producer, Tim Gwynn, with a video stream. You can watch us at wvmetronews.com. The phone number is 1-800-765-8255. Email me, talkline at wvmetronews.com. Tweet me at Hoppy Kercheval. Text me 304-TALK-304. Coming up this hour, we'll talk with the just hired new head of the Department of Military Affairs and Public Safety in West Virginia, Jeff Sandy. Jeff Sandy, hired by the Justice Administration, and he will replace Joe Thornton. And the Department of Military Affairs and Public Safety, you don't think you hear a lot about that, but it's a huge department. It involves the state police. It involves the Homeland Security, it's correctional officers, it's prisons. It's a very large agency with many responsibilities. So we'll talk to Jeff. And Jeff Sandy has a deep background in law enforcement and security. So we'll talk to him. We'll meet him coming up at 10:30 this morning. Special attention to Wood County because he's the former sheriff of Wood County. Also coming up, Randy Huffman, expected to join us in the 10:30 to 11 o'clock window. Huffman is leaving the Department of Environmental Protection. Now, this is a very important agency that oversees, obviously, state environmental issues. There are a lot of regulatory issues there. And he has decided after 8 years to leave. And I don't get the sense that he was on his way out. He may have been retained by justice. They may have even wanted him to stay. I'm not exactly sure. The word was that Huffman might be one of the cabinet secretaries that was going to stay, but Huffman has decided to leave. He is a career military man. He's been in the military for 30 plus years, a long time member of the National Guard, and he is leaving to take a position with the West Virginia Air National Guard. So Randy Huffman leaving as Secretary of DEP, and he will join us later this hour to talk about